this section, I will talk about antipsychotic medications, which are the main class of medications used to treat schizophrenia. Before I start, I want to be very clear that I'm not a medical doctor, and what I'm saying should not be considered in any way to be medical advice or treatment. It's the job of the treating physician, hopefully a psychiatrist, to determine the best treatment for a person with schizophrenia. With that said, I want to give you an overview of the role of antipsychotic medications in the treatment of schizophrenia and address some questions that frequently come up. How do antipsychotic medications work? Research has found that antipsychotic medications are effective for treating the positive symptoms in schizophrenia. Just as a quick refresher, the positive symptoms of schizophrenia include delusions, hallucinations, and disorganized thinking and speech. It's not exactly clear how these medications work, but one common feature is their ability to block the action of a neurotransmitter or chemical messenger in the brain called dopamine. Research suggests the malfunction of this chemical messenger system, as well as others, cause symptoms such as hallucinations and delusions. How long do antipsychotic medications take to work? All antipsychotic medications must be taken as prescribed. Their effects can sometimes be noticed within the same day of the first dose. However, the full benefit of the medication may not be seen until after a few weeks of treatment. So don't stop taking your medication because you think it's not working. Give it time. What if my medication doesn't work? Sometimes the antipsychotic you first try may not lead to improvement in symptoms. This is because each person's brain chemistry is unique. So what works well for one person may not be as effective for another. Be open to trying another medication or combination of medications in order to find a good fit. Let your doctor know if your symptoms have not improved, and most importantly, do not give up searching for the right medication. Can I stop taking my medication? Once you've responded to treatment, it's important to continue treatment. To prevent symptoms from coming back or getting worse, don't suddenly stop taking your medication, even if you're feeling better. Stopping your medication can cause a relapse. Medication should only be stopped under your doctor's supervision. If you want to stop taking your medication, talk to your doctor about how to correctly stop. However, do keep in mind that the vast majority of people with schizophrenia need to remain on some form of medication throughout their lifetime to control their symptoms. What if I miss a dose? Most antipsychotics are prescribed once daily. If you forget to take your medication, don't double up the next day to catch up on the dose you missed. If your medication is prescribed to be taken twice a day and you forget to take a dose, here's a rule of thumb. Take your medication if it's been 6 hours or less from the time you were supposed to take it. However, just skip the forgotten dose and resume your medication at the next regularly scheduled time if it's been more than 6 hours after the dose should have been taken. Again, never double up on doses of your antipsychotic to catch up on those you forgot. Let's talk about the types of antipsychotic medications next. Antipsychotic medications are often put into two different categories, first generation and second generation antipsychotics. I'm first going to go over the names of the first generation antipsychotics. One thing to note is that prescription drugs go by two names, their brand name and their generic name. I'm going to read off the brand names since that's probably what you're most familiar with, but you can see the generic names in parentheses if that's what you're looking for. Okay, so let's go over the first generation antipsychotics, which are also known as conventional or typical antipsychotic medications. These medications include Haldol, Prolixin, Thorazine, Trilofan, Navaine, Stelazine, and lastly Loxetane or Loxapac. Let's go over the second generation antipsychotic medications next. This class of medications are newer and were introduced in the 1990s. And with the exception of clozapine, they have similar effectiveness for treating schizophrenia compared to the first generation antipsychotics. Clozapine has been shown to be more effective than other antipsychotics, but it does have some challenges in terms of side effects. I'll talk more about clozapine a little later. The second generation antipsychotics are also referred to as atypical antipsychotic medications. Drugs in this class of medication include Risperdal, Zyprexa, Seroquel, Geodon, Abilify, Clozaril, Safras, Fanapt, Latuda, and Invega. Some of the medications we just went over are also available as long-lasting injections, which are given every 2 to 4 weeks. Use of injectable medications is one strategy that can be used for people who regularly forget to take their medication. Some people find these more convenient because they don't have to take their medication daily. The medications that come in injectable form are Prolixin decanoate, Haldol decanoate, Cybrexarelprev, Sustenna, and Consta. The side effects of these medications are similar to their oral counterparts. Let's talk about side effects next. Like all medications, antipsychotic medications can have side effects. In many cases, they are mild and tend to diminish with time. Many people have few or no side effects, and the side effects people typically experience are tolerable and subside in a few days. Your doctor will discuss some common side effects with you. Check with your doctor if any of the common side effects persist or become bothersome. In rare cases, these medications can cause severe side effects. Contact your doctor immediately if you experience one or more severe symptoms. If you do experience side effects, be sure to talk to your doctor before making any decisions about stopping treatment. In terms of the more severe side effects, some people experience side effects that mimic symptoms of Parkinson's disease, which are called Parkinsonian or extrapyramidal symptoms. These include tremor, shuffling walk, and muscle stiffness. A related side effect is akathisia, which is a feeling of internal restlessness. Additionally, prolonged use of antipsychotics can cause tardive dyskinesia, a condition marked by involuntary muscle movements in the face and the body. An uncommon but serious side effect is called neuroleptic malignant syndrome, or NMS. These symptoms include high fever, muscle rigidity, and irregular heart rate or blood pressure. Contact your doctor immediately if any of these symptoms appear. Weight gain, changes in blood sugar regulation, and changes in lipids such as cholesterol and triglycerides are common with some antipsychotics. Therefore, your doctor will check your weight and your blood chemistry on a regular basis. Each of the antipsychotic medications differs in its risk for causing these side effects. If you have a scale at home, you want to regularly check your own weight. If you start to gain weight, talk to your doctor. It may be recommended that you switch medications or begin a diet and exercise program. I mentioned earlier that clozapine is a very effective antipsychotic, but I also want to mention that it can cause a granulocytosis, which is a loss of the white blood cells that help a person fight off infection. Therefore, people who are prescribed clozapine must get their white blood cell counts checked frequently. This very serious condition is reversible if the medication is stopped. Despite the serious side effect, clozapine remains the most effective antipsychotic available and can be used safely if monitored regularly. Okay, that wraps up our discussion of medication treatment of schizophrenia. I do want to mention that medications we didn't discuss, such as antidepressants, are also used in the treatment of schizophrenia. Covering all these classes of medications used would be beyond the scope of this video. So instead, we focused on the first line of treatment for the disorder, which is antipsychotic medications. Join me next time to talk about how family members can help their relative with schizophrenia.